Campbell Brown.
No bias, no bull.
CNN weeknights, 8 Eastern.
We've been hearing from lots of you about a story we first reported last week, our investigation into the security of your medical insurance records. None of us could believe how easy it is for complete strangers to access your most private information until we saw it for ourselves. And it all has to do with your medical records now being computerized. And that's a key part of President Obama's stimulus plan. Listen to what he said about it today.
But when it comes to health care, it's a disaster. So what we did is, in this plan, in the House bill that passed, one of the things that we do is we say, we are going to computerize our health care system, institute health IT. That creates jobs right now for people to convert from a paper system to a computer system. But it also pays a long-term dividend by making the health care system more efficient.
Efficient, yes, but your privacy may also be at risk. And our senior medical correspondent, Elizabeth Cohen, is back to tell you what you can do to protect yourself. And Elizabeth, what's the fine print here?
There is some fine print that we all need to pay attention to, Campbell. But first, I want to show you what happened on your show last week when I tried to gain access to somebody else's health information.
Elizabeth Cohen has been hard at work at her computer.
An unusual challenge. Go online and get Gary Tuckman's health insurance records.
And then we're going to come back and see what you found.
I will accept the challenge.
In minutes, guess what I found?
So you know that's my children's pediatrician from
I do
Sneak
know.
On My Records.
I do know, because I got them all right here, Gary. I got all your insurance claims for the past 18 months for you and your entire family, and all you gave me was your date of birth and your social security number. That was it.
Getting Gary's health insurance claims was shockingly easy. I could see it all. A list of every doctor's appointment he and his wife and children have had for the past year and a half. He couldn't believe it, and neither could many of you. Here are some emails we received. Could you please tell me what website I need to access or the process to secure or protect my health insurance claim history? Help! What is the website she referenced? Medical records will be online. It's just a matter of time.
So, Elizabeth, walk us through it. I mean, what should we do to protect our information as best we can?
Campbell, the first thing you have to do is think, who has information about me that I would not want the world to know about? So sit down and make a list. For example, your doctor may have your medical records online, a pharmacy, an insurance company, a hospital, all of those to some degree or another are starting to put things online. Secondly, when you find out that they do have information about you online, go and log on and create an account for yourself using a safe username and password. And thirdly, answer those security questions. You know, your mother's maiden name, your pet from childhood. Set up some of those security questions so that nobody else can access your information. Now, Campbell, I want to add that we got in touch with Gary's insurance company, and they said that their site is compliant with federal privacy rules called HIPAA rules, but they said there always is room for improvement. Campbell?
And Elizabeth, we should be clear about one thing. And there are real advantages to making medical records electronic also, right?
Oh, absolutely. I once did a story with a gentleman who had a CAT scan, and the doctor called him and said, your CAT scan looks fine, you don't have any problems. Well, because these records were online, the patient went on and read his own CAT scan report. He wasn't fine. They found a spot on his thyroid. He had thyroid cancer, and his doctor completely missed it. The patient caught it only because his records were online. And that hospital that gentleman uses, they have a much more secure site than the insurance company that we've been talking about.
All right, Elizabeth Cohen for us tonight. Good stuff, Elizabeth. Thanks very much.